Health in North Korea, Wikipedia audio. North Korea has a life expectancy of 69.7 years as of 2014. While North Korea is classified as a low-income country, the structure of North Korea's causes of death is unlike that of other low-income countries. Instead, it is closer to the worldwide averages, with non-communicable diseases such as cardiovascular disease accounting for 2/3 of the total deaths. A 2013 study stated that the largest obstacle for understanding the accurate health status of North Korea is the lack of the validity and reliability of its health data. Healthcare in North Korea includes a national medical service and health insurance system. North Korea's government provides universal health care for all citizens. Health infrastructure. North Korean health services are offered for free. In 2001, North Korea spent 3% of its gross domestic product on health care. Beginning in the 1950s, the DPRK put great emphasis on health care, and between 1955 and 1986, the number of hospitals grew from 285 to 2,401, and the number of clinics from 1,020 to 5,644. Special health care is available mainly in cities, where pharmacies are also common. Essential medicines are well available. There are hospitals attached to factories and mines. Most hospitals that exist today were built in the 1960s and 1970s. During the rule of Kim Il-sung, effective mandatory health checkups and immunization programs were initiated. The country could support a large corps of doctors due to their low salaries. The number of doctors remains high, though there is a shortage of nurses, meaning that doctors often have to perform routine procedures. The medical infrastructure is fairly effective in preventative medicine, but less so in terms of treating the more demanding conditions. Since 1979, more emphasis has been put on traditional Korean medicine, based on treatment with herbs and acupuncture. A national telemedicine network was launched in 2010. It connects the Kim Man-yu Hospital in Pyongyang with 10 provincial medical facilities. North Korea's healthcare system suffered a steep decline since the 1990s because of natural disasters, economic problems, and food and energy shortages. By 2001, many hospitals and clinics in North Korea lacked essential medicines, equipment, and running water due to the economic embargo and blockade by the US and the international community. Electricity shortages remain the biggest problem. Even if sophisticated equipment were available, they are rendered useless if electricity is not available. Some facilities have generators available to meet demand during power outages. In 2010, the World Health Organization described the healthcare system as the envy of the developing world while acknowledging that challenges remained, including poor infrastructure, a lack of equipment, malnutrition, and a shortage of medicines. WHO criticized an earlier Amnesty International report that described barely functioning hospitals as outdated and factually inaccurate. North Korea has a life expectancy of 69.7 years. The 2009 gender breakdown was 72.8 years life expectancy for females and 64.9 for males. Cardiovascular disease as a single disease group is the largest cause of death in North Korea. The three major causes of death in DPR Korea are ischemic heart disease, lower respiratory infections, and cerebrovascular disease. Non-communicable diseases risk factors in North Korea include high rates of urbanization, an aging society, high rates of smoking and alcohol consumption amongst men. Approximately 54.8% of all North Korean adult males smoke an average of 15 cigarettes per day. Smoking prevalence is slightly higher amongst the urban worker population than the farming population. Amongst men, a high rate of excessive alcohol consumption has been reported, defined by the World Health Organization as consumption of more than one bottle, per sitting, per person. In the past, North Koreans did not have many problems with dental health because their diet did not include lots of sugars. Since the 2000s, sugar has been introduced to diets in the form of candies and sweet snacks, especially in urban areas. Toothpaste is not regularly used. Health status. In 2003, infectious diseases, such as tuberculosis, malaria, and hepatitis B, were described as endemic to North Korea. An estimated 4.5% of North Koreans had hepatitis B in 2003. In 2010, Amnesty International reported that North Korea was experiencing a tuberculosis epidemic, with 5% of the population infected with the disease. It attributed this to the overall deterioration in health and nutrition status of the population as well as the rundown of the public health services. In 2010, infections that cause pneumonia and diarrhea were reported to be the leading causes of child death. In 2009, one-third of the school-aged children in North Korea were assessed as having diseases caused by intestinal parasites. WHO estimates that North Korea has less than 100 people with HIV/AIDS. According to UNAIDS, less than 0.2% of North Korea's adult population has HIV. Officially, the country maintains that it is completely free of AIDS. During the 1990s, North Korea was ravaged by famine, causing the death of between 500,000 and 3 million people. Food shortages are ongoing today, with factors such as bad weather, lack of fertilizer and a drop in international donation meaning that North Koreans do not have enough to eat. A study of North Koreans in 2008 found that 3/4 of respondents had reduced their food intake. Extreme poverty is also a factor in the hunger faced by North Korean people, with 27% of the population living at or below the absolute poverty line of less than $1 a day. These food shortages cause a number of malnutrition diseases. For example, a 2009 UNICEF report found that North Korea was one of 18 countries with the highest prevalence of stunting among children under 5 years old. Life expectancy. Non-communicable diseases. Dental health. Infectious diseases. HIV/AIDS. Malnutrition. Bibliography.